So today I wanted to discuss a pretty important topic for athletes, parents, coaches, and anyone really involved in sport like soccer, rugby league, AFL, all these contact sports, and that's concussion. So how to recognize it, what it is, and what to do, and how to make sure that moving forward, that players who do suffer a concussion, how they can be best protected in the weeks and months to come. So I guess probably start off by a concussion is considered a transient injury to the brain. It's a very, very, very mild form of essentially a reversible brain injury where there's been a sudden acceleration or deceleration of the brain inside the skull. And this causes essentially a contusion or a bruise, which doesn't always happen, but for lack of, for a better understanding, that's, a simplified way of describing a very complex neurological process that happens. So I guess, the FFA's rules for soccer and concussion is that anyone who displays after a head knock any signs of dizziness, disorientation, mood changes, headaches, problems with vision, light sensitivity, or confusion, they should be considered that they have the potential for a concussion and should be removed from the field of play and not returned to the field of play. In the NRL and AFL, there are specialised sports doctors and independent medical examiners who perform these examinations. So they obviously have their own rules, but I guess in the community, it's very, 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 very unlikely that there is anyone at that field who can make a determination as to whether the child or the athlete has a concussion or that they don't. And so, what I would typically recommend to people is if you think a concussion assessment needs to be done, then it's most likely that they do have a concussion and that they should be removed from the field of play. We have tests at our availability as medical professionals, such as a SCAT, which can help determine these things. But even still, that testing isn't a pass fail for a concussion or not, it's a indication. So I would often argue if people have any symptoms that you feel like you need to do that, it's probably easier to assume that they have a concussion and remove them from the field of play so you don't induce further risk, as opposed to potentially trying to go on Saturday afternoon for another 20 minutes in soccer, which will provide no long term value to anyone in that region. So once they're removed from the field of the play, I guess the times that I'd be like, right, you need to get yourself off to the hospital and have this looked at is if they are unable to return to consciousness, they are having any sort of seizing, they are vomiting, they are quite delirious, and after a few minutes are unable to really recognize where they are or come to any of their senses, or a headache that is increasing in intensity and is not relieved. So, any of those symptoms, I would be taking the athlete straight to the hospital for an examination and letting a trained medical professional determine what the best course of management from there. I guess what we do in the rehab, so I had a young patient here the other day who'd sustained a concussion from some dancing. She'd sort of fallen from a height and landed on the back of her head. The management she'd been given was, just don't dance for a while. But during that time, she was still going to school quite intensely and uni quite intensely, and so her symptoms weren't really improving. So I try and look at concussion that your brain needs rest and it needs aggressive rest. So things that require thinking, like schoolwork, homework, computer games that have lots of lights and signals where there's a lot of stimulation, these things are not helping your symptoms. So we often say to people, you need to recharge your brain, so low sensory environments, so sleep, just getting out into nature very gently, or staying in a room that's got a low lights, calming music, doing those things to help your symptoms settle. When people come into the clinic, we do some of those elements of the SCAT test to sort of see where they're at in terms of like neck pain, headache, dizziness. And then our rehab is really based around retraining the vestibular system. So we know that lots of patients after a concussion will have dizziness and problems with their balance. So we will do training for those sorts of exercises. We'll also do training for their eye gaze and control, which can really help people improve faster. And we do a lot of neck strength and neck manual therapy because we know that weakness in the neck is a really big predictor for ongoing pain and disability after a concussion. So we know female soccer players suffer higher rates of concussion due to weakness in their neck extensors. So trying to prevent the next concussion by doing some neck extensor strengthening is really important. So I guess in conclusion, like hopefully the more people who know about concussion, the better. There is definitely a changing trend in the community as to how we manage it. Like I know as a child myself, it was just like get up and keep going after being knocked out. But now, if anyone's knocked out, they really should be removed from the field of play and given adequate rest. There is a lovely, lovely flow chart that I'll put up on the socials from the AIS that has the pathway you can follow for recovery. And this, takes a minimum of 2 to 3 weeks now. So we do not recommend that players return to whatever the sport might be in the first 7 days, because we know that it's very difficult to recover within that time frame. The professionals have, different ways to assess and validate this, but in the amateur level, we'd be recommending 2 to 3 weeks before kids return to play to ensure optimal recovery. A concussion itself is often not dangerous, but a concussion on top of a concussion is where the damage starts to stack. And that's what you're trying to reduce by having a longer time out from soccer. So if you've had a concussion and you're still struggling with any sort of dizziness or balance issues, give us a yell, because there's some very simple rehab we can give you to get you firing. And if you've got any questions about how your team or your club manages concussion, then reach out to us and we can provide you with some appropriate resources to get you started. See ya.